What does a complete thyroid evaluation really look like? I think the issue in terms of really doing a deep dive on thyroid symptoms and disease with people is that typically we're only screening with the TSH, which stands for thyroid stimulating hormone. It's the messenger from the brain to the thyroid about supposedly where your thyroid balance is. But once that messaging occurs, the thyroid then makes two forms of thyroid hormone. One of them is a storage form called T4, and the other is an active form called T3. And both of them are important in the body as they're circulating, doing all the things that we think about in the thyroid world. So mood, energy, metabolism, brain function, cholesterol balance, hair, skin, nails, bowel function. But we need that T4 storage form to turn into T3, the active form. And it's the T3 that really ultimately is, once again, that key that fits in that cellular lock like hormones do, that create all the good things that we think about with thyroid. So we really just can't screen with the TSH, because sometimes what we see in the circulation is not messaging perfectly to the brain, and that TSH may not pick up symptoms and issues related to low thyroid hormone levels. So the complete thyroid hormone analysis should include TSH, so the brain's message to the thyroid gland, something called free T4 and total T4. Again, these are storage forms, and we look at both because it tells us something about thyroid binding globulin, which is a transport hormone that transports your thyroid hormone around. And then most importantly, the free T3, which is this active form of thyroid that makes everything happen in the thyroid world, as well as a reverse T3, which is a braking system. So your gas, your free T3, and your reverse T3 are balancing each other. And the issue is that if you have a large amount of reverse T3, that can sit on the thyroid receptor and prevent that gas or that free T3 from working. And oftentimes we see high levels of reverse T3 in people with stress. So we look at all those levels. In addition, we want to look at thyroid antibodies to rule out the condition that we call Hashimoto's, which is an autoimmune thyroid condition where you'll have elevations of thyroid peroxidase antibodies and thyroglobulin antibodies. And these things are important to measure because they can come up and actually begin to destroy your thyroid gland. When we see that, we really focus once again on autoimmunity, because Hashimoto's is an autoimmune condition versus a true just thyroid underfunctioning condition. And both things must be addressed, both the autoimmunity and the thyroid hormone levels.